We'll welcome them later. But I'm Dr. Marotta. Thank you for joining us today in Rome. And as always, the housekeeping. This neuropsychiatric program requires a trustful environment. Meetings are by invitation only. Please do not forward the invitation to anyone else without the consent of the meeting host. To ensure a confidential workspace, you should make sure your participation is done in a private environment. Individual participation is preferred. If it's a group, the host must be made aware of all attendees. So please sign into Zoom or sign in over here using your first and last name. And no one has permission to record other than the people with permission to record. If you wish to receive CME or any other attendance certificate, you need to sign in and sign out each day to confirm. And at some point, you can download this code onto your cell phones and put it in, and then you'll get the certificates. All right. Or you can probably go online to where the sign in was and it'll be there too. Okay, so finally, all planners, speakers, individuals in control of content of this educational activity have no relevant financial relationships to disclose. With ineligible companies whose primary business is producing, marketing, selling, reselling, or distributing healthcare products used by our patients. Did you write that down? Okay, so thank you for joining us. And I'm supposed to continuously remind you to sign in. Okay. Yeah. All right. So I think I must have said pending crisis about 24 times yesterday, and because I believe in it, but it occurred to me that maybe I think there's a crisis because now that I'm older, I think it's the end of the world because maybe it's soon the end of my world, and I can't imagine the world existing without me. But I actually, I mean, you know, when one of the things we're going to do is on COVID. And when Dr. General Xenakis and I actually wrote the initial lectures we gave on COVID, we started doing it early in the epidemic, it occurred to me that my father had been born during the great pandemic of 1918, 1919, that my grandfather was chased by the virus. I found all his letters in my great-grandfather's house in southern Italy. In that house, which is part of the family house, there's all the letters from all the sons, grandsons from the war, all the wars. They're all stacked and they're all filed. So I found the letters from my grandfather, who was an American soldier, to his father, who was an Italian officer, and his mother always saying everything's fine. It's just dandy on the Western Front. You know, the food is good, Mama. Don't worry about that kind of stuff. But I also followed his training, and I had read a book on the Great Epidemic. My grandfather always seemed to be ahead of where it was. You know, there was very high death rates in certain military camps in the upper Midwest, and he had been there. He shipped out of Philadelphia, and Philadelphia became very, very bad. He was immediately after landing in France, he was sent to the front, and the soldiers at the front were isolated, and the virus didn't have a big impact on the soldiers who were there early. He was always somewhere else. A lucky fellow in a lot of ways, as he told me. I grew up during the polio epidemics, and I remember kids disappearing. And I remember a girl, you know, in our gang of little children getting strep throat and dying, and the fear of the parents. And so I had this sense of something bad. So when COVID occurred, it occurred in that context of things happening. So maybe that's why I also always think the world might end in some way. It's and so possibly it's part of my obsession with COVID and schizophrenia and all the interactions. So I just wanted to, but so it's one of the things we're going to talk about today is that continuing idea that we may be facing a crisis, but then again, maybe we're going to be lucky and nothing's going to happen. And we can move carefully and slowly to reforming the use of clozapine and getting more people cared for, and nothing really terrible will happen. So I just wanted to, that's my confession to you all. Yeah, I think we're conditioned by our childhoods in some ways that are conscious, in some ways that are not. And then I think also if you were raised as a Roman Catholic, there's always the sense of, sin is going to be, things are going to happen. Right, Irene? Okay. So that the theme of changing case presentations and the theme of difficulty of treatment may or may not play out, though it seems to be playing out. But we're gonna, so that what I call the vertical organization of these 2 days will some of that will come up, but performing more on the horizontal, which is Irene's going to speak this morning on her efforts to extend the care to other people. So to take the model, right, and see if she can make it all happen at less overt cost to the people being treated, right? I'm trying to say that when you really think about the cost of things, it's always there, right? It's going to be paid indirectly or directly by tax dollars, or it's going to be paid by families themselves, taxing themselves, if you want to, but still, it's to make it available in a way and to do the best we can in treating people. So Irene will talk about that. And then Chris Landry is going to talk about the wonderful work the Fountain House people have done for 75 years, right? So, and the Clubhouse movement to deal with severe mental illness and to really make happen what we say is necessary, a sense of community, a sense of interaction. It's not just medicine, it's not just any one thing, right? And Fountain House has been a wonderful factor in making it work for so many people for so many years. Laura's gonna talk on what, to me, as a New Yorker, is the interplay of politics and law and public policy and what really happens to people on the street. At least that's how I see it, because Laura is an attorney and she has to deal with how these things play out. And more we see how difficult this is, right? And how we live in a world where it's just not a simple thing, because we have competing demands, liberty, right? Independence, as opposed to what's best for a given individual, right? We're supposed to be motivated by magnificence, Christopher, is that our? Oh, no, no, I mean, the medical thing is that we're beneficent, right? Yeah, we're doing it out of the goodness of our heart, right? But there are other competing, principles, what's the right word? Constitution, the Constitution of the, in the pursuit of happiness. Yeah, and they're dialectics at play there. All right. And then this part of what brought us all together was the book. So I'll just say it quickly, because we were trying to write a book about the specific details of what we were doing with medications, and I just couldn't seem to do it. So Peter Fogarty from London, he said, just write about what you actually do, and so I couldn't do that either. I could talk about it, I can't write about it. But Dr. Mann actually can write. You're going to get a ghostwriter. I married a ghostwriter. I'll just say Lisa also really wrote most of her father's autobiography when he was older. So I knew she could write. I also knew she could write because her thesis is in her house and stuff. So I had an idea. And she was a lit major at Harvard. So what? Well, Catherine, Dr. Doherty and Lisa are an amazing team. Just an amazing team. I, and so we're blessed to have them working. So we want to talk about that because that it addresses the problem of the patients, the families, the staff, and how to put things together. And that'll be discussed. Did I leave anything else out here? I wanted to give you a little bit more time, Irene, so I'm going to try to just, because we're going to keep talking back and forth. So would you be ready just to start? Either way, you're the only Irene I know.